the first European Cancer Nurses Day. And this is on the eve, of course, of your own 25th anniversary. So happy anniversary for that tomorrow. So today we've got a packed education programme for you. We're starting off with aspects of safety, and you'll hear from different speakers about different aspects of safety within your practice. We then go on to look at education, before we look at emotional aspects of care, and then finishing off with leadership and advocacy. So we hope you're going to really enjoy the programme today. As I say, it's packed, so but we will have time for questions, so I hope you enjoy it. We've got a few things to just say before I introduce the two presidents. Firstly, those of you with earphones, I don't know if you'll understand me, but those of you with earphones, we need to give those in at the end of the day, otherwise we'll have a big fine, so that would be good if you could do that. On each of your chairs and within your packs, you have a questionnaire, and this is to help us gather data about the experience and the education and anxieties, if you like, of cancer nurses. So we would be really grateful if you could fill those in. There's a box on the table on your way out so that you can put them down there. They're completely anonymous and confidential, so please don't worry about that, and help us and fill in your questionnaires. There isn't a fire alarm booked for today, so if the fire alarm does go, that's where our exit is, so we'll all be moving towards that exit. I've got a few other things to say, and then I'm going to hand over. In terms of photos and filming, we will be filming today and taking pictures. So if those of you that don't want to be part of that, please let us know. If you could let Paul know, who's on the end there, wearing a RECAN t-shirt, he will then make sure that you're not included in any photos or film. We are tweeting. I think that's the right word, Paul. Tweeting. So please do, those of you that tweet, feel free to tweet like mad. I've got a few other things. Let me think. Questionnaires, sponsors. So today has been sponsored, and we're really grateful for our sponsors for that. It means it keeps our costs down, and it makes it much more freely available for yourselves. So please make sure that you visit our sponsors' stands, which are next door. Now, I think I've said everything. So it gives me great pleasure to introduce the presidents of two societies. Firstly, Danny Kelly, who all of you will know is the president of EONS, and he's going to give us a welcoming address. And of course, your own president, Christina, oops, I forgot how to say it. Karp, sorry, Christina, who will welcome you to the day. So I'll hand over to Christina first.
So, dear colleagues and friends, as it is an international event, with your permission, I will continue in English. On behalf of Estonian Oncology Nursing Society, it's our honor to host leading European cancer nursing platform, European Oncology Nursing Society, EONS. This year and date is very special to Estonia cancer nursing. On its 25th annual spring conference, Estonian Oncology Nursing Society, with the support of EONS, is celebrating first European Cancer Nursing Day here in Estonia, Tallinn. We would like to express our profound gratitude to all EONS team for their work and support for this conference. We also want to express our thanks to all speakers who will share their huge expertise and knowledge with us. We are very grateful for our Estonian partners who were networked with us. And finally, I want to thank all participants who have come and make this day possible. We hope that you enjoy this conference, and we want you all to challenge for look to the evidence together and recognize the importance of cancer nursing from all over Europe. So our great pleasure to welcome you on first European Cancer Nursing Day here. Thank you.
Thank you, Christina, and good morning, everyone. It's a great honour and a great pleasure for EONS to be here today. We had a wonderful trip yesterday to Tartu, and we saw the fantastic hospital there. So you're very, very lucky to have that wonderful facility. We were very jealous of your new hospital. This is a very important day for marking the contribution of nursing. It's the first European Cancer Nursing Day. There's a lot of people across the world today who will be thinking about nursing, and that is very, very important. So we're very pleased to be here in your city and in your country to launch the first European Cancer Nursing Day. And to do that, we've got a range of topics that we hope you will find relevant. You may want to think about how they link with your own country and your own ambitions for nursing here in Estonia. So that's enough from me. I'm going to show you now, we have made a special film with some nurses from London who helped to tell us and show us their work, and also people from the EONS board. And it's a film that will be available from today, and we hope that you find it interesting, and we think it's a fantastic exhibition, if you like, of cancer nursing. So have a great day, and I'll see you later. Thank you.
Okay, so our first speaker probably needs no introduction. She's our president-elect from Sweden, and that's Lena Sharp. And Lena's going to talk to us about patient safety and communication.
Thanks,
Lena.
I need to raise the microphone. Fantastic to be here and to see the full room of colleagues. It's just amazing. A few of us have been working really hard to make this happen. So today is, like Danny said, really a big day. And I'm going to talk about team communication and safety, which is a topic. When you talk about safety on hospital, you normally talk about accidents, disasters, bad stories. But I'm going to do the opposite. I'm going to talk about a really good sunshine story, at least to start with. And this is a true story from Karolinska University Hospital, where I used to work. For many years, I was the patient safety coordinator for the oncology department there. And this story started in a hospital lift. The key actor was a young nurse assistant. She's just started a job at the oncology ward on the 3rd floor. And she was going in a lift down to the bottom floor, actually down to the basement, to the radiotherapy unit, together with a very experienced oncologist. And this oncologist, she started to talk with this nurse assistant. She said, "How do you find the work? What do you see in the patients? Is it anything you want to talk to me about?" So she opened up the communication. The nurse assistant was quite nervous about it, but she said, actually, there was something with the patients on room 4 this morning. She was not okay. There was something. They stopped the lift, went out and ran up the stairs and went into room 4, and they managed to save this woman's life because she was getting into a septic shock. And what happened was that the nurse assistant, she couldn't put the medical terms of what she saw, but she saw that something was wrong. And since the oncologist opened up and wanted to listen to her, she realized she's saying this for a reason. She sees something that might affect the patient. So they actually saved this woman's life. So they put safety first, not the background education or your role. They put safety first. And all the team learned. You have to listen to each other. whoever you are, it doesn't matter who you are, everybody can contribute to the safety. It's not all sunshine stories like that, but they're quite common. And patient safety is a big deal. If you look at this report presented in the British Medical Journal, you see that causes of death, number 3 is actually patient safety or incidents on hospitals after heart disease and cancer. That's quite alarming, isn't it? And that's in the US. So how is it in Europe? It's pretty much the same. Of course, it can vary from organization to organization, but EU have done quite a lot of work, and they see that 10 to 15% of the patients in the hospital experience some kind of medical error, some incidents. And the most common problem area is the professional communication, which means communication within and between the team. Not always with the patient, but how we communicate with each other. The second one is normally about medication administration. And also there, it's very often about communication, miscommunication or misunderstandings that leads to incidents and medical errors. And the third one typically is about handling technical medical equipment. WHO have alarmed us a lot about patient safety issues, and they talk about healthcare today that is more effective, so we have better healthcare today, but it's also more complex. And we use more technology in healthcare, more medicines, more treatments, and of course in cancer care this is very relevant. Our patients on hospitals today, they tend to be older and sicker. You don't get to stay on a hospital unless you're really sick today. Which means that we as healthcare professions have to make more difficult decisions. We also have the economy, pressured economy, and overloaded healthcare environments. So what about the situation in cancer care? Well, you know what type of drugs we use in cancer care. They're really potent drugs. And we also know that cytotoxic agents are the most common drugs involved in medical errors. That's quite scary, isn't it? So the very dangerous drugs we use, they're very often involved in errors. It could be, of course, that we tend to report these errors more than if it's more basic drugs. And we also have more patients in outpatient settings, so not in hospitals. We have new drugs. We talked about that with the people in Tartu yesterday. There's so many new drugs in cancer care, we don't even know all the names of them. And our patients are vulnerable. They can't always speak up for themselves. And we know if we make mistakes, it might have a catastrophic consequence. And what has this to do with communication? Well, communication in healthcare is very complex. You see a patient in the middle there, but there's a lot of communication between very many people. And if just one of those dotted lines doesn't work, you can risk having a miscommunication that could lead to patient harm. And I would say handovers rather than transitions. Handovers in healthcare is an area of concern. When you hand over your patient to the next nurse, the next shift, the next professional group, the next hospital or unit or healthcare provider, that's the risk in miscommunication. That's when the risk is the biggest. And we do a lot of handovers as nurses. And that's been described as a time-consuming and quite a conservative ritual. And we've been criticized as nurses, and rightly so, I think, for not using these handovers for discussion, reflection, or education. We put more focus, if we're self-critical, on telling the next shift what a terrible night or morning or afternoon we had, than what they need to know to deliver the safe care. So this is a critical moment for medical errors, and you can have verbal, oral handovers, and they all have, or written handovers, and they all have benefits and challenges. So what's the relationship between patient safety and professional communication? Well, we all know that high-quality healthcare, you need cooperation and teamwork. We also know that no single person or member of the team have all the knowledge you need. But still, we see a lot of solo performances, people working on their own, not following the protocol. Quite often these people have important high positions, and we let them get away with doing it their own way, not following the routines, which is a risk. We talk about communication skill as a key ingredient, but still we have very limited education as nurses and doctors in our training. We are trained to communicate with patients and their families, and that's very important, of course, but we also need to be trained in communication within the team. So what happens if the communication in the team is not working? I'm sure you've been involved in all this situation. You see conflicts, right? Unclear roles and responsibility, and the information between the professional groups is not transferred in a good way. Oh, I'm very sorry, and of course it's my fault. Sorry. Car rental people. So you need to go down to the car. Sorry. Yes. A metaphor that can be used for communication in the team when it doesn't work is what we call Chinese whispers, which means if I whisper something to Christina, that continue to Danny, to Iveta, and all the way down to the end of the room, the story have changed so many times. So that's what's happening. If we don't have good communication, I tell you something that you tell to somebody else, and it keeps changing. You also see poor leadership when the communication doesn't work. And you tend not to report incidents, even if you notice the incidents. And this poor communication tends to strengthen the hierarchies, so the different levels that we order our hospital staff in. And all this increases the risk for patient safety errors. So why is it so difficult to make it work? Well, it's important to remember that this is not caused by neglect. We know the hierarchies in hospitals is making it difficult, like the story I said in the beginning of the young nurse assistant. If she didn't speak up because she had too much respect for that doctor, the patient probably would have died. But it's hard. And we also know that when we're stressed, and we are much stressed if we work in hospitals, our communication skills go right down. And also, I think you recognize this, we communicate really important issues when we're busy with something else. So you can sit with the patient giving chemotherapy, some of your colleagues come in and tell you something really important, but you can't reflect and ask questions because you have to concentrate on what you do. And that's what we do all the time in healthcare. In our research that we've done on Karolinska, the staff themselves describe this as flying information. There's a lot of flying information, very important, but you don't really know how to deal with it. And sometimes you might interpret information differently than it was intended, depending on what morning you had at home, what situation you're in, depending on who you're communicating with. And I'm going to give you some quotes here from our research at Karolinska that shows that hierarchies affects patient safety. This is from a nurse from the radiotherapy unit. she said that I saw that the doctor didn't notice that the patient had previous radiotherapy to the same target area, but I thought he's an experienced oncologist and he knows what he's doing, so I didn't say anything. So this nurse didn't speak up, and the patient had the treatment that he shouldn't have had. And then it works the other way around, of course. Here is a very experienced doctor saying, the nurses don't have to sit and write so much in the hospital files. It's better if they just tell each other when they meet in the changing room between the shifts. So this doctor reduced the nursing handover to something that you could do when you change clothes. Of course, and you can understand this doctor probably doesn't read the nurses' notes in the files or listen much to nurses. And this happened in Sweden, that today I saw what's voted the most equal country in Europe. And this is a doctor a couple of years ago that said that. And also something that you do if the communication doesn't work, and this is also to do with hierarchies. This is also from radiotherapy. We should call the doctor when you have a new patient so they can view the images before you treat. But sometimes the doctors are on lunch break and you don't want to disturb them. And the interviewer asks, what do you do then? Do you treat the patient anyway? Yes, sometimes. They need their lunch and the patient can't cope with waiting so long. So they sidestep the guidelines to please the doctors that was on lunch. And this is a good example that this is a system problem. It's not the individual nurses. They should not have patients, new patients, that need a doctor if the doctor is on lunch. So it's the system that's system failure. And here is actually a nurse assistant from one of the units, one of the wards. She said, it feels like I'm pretty far down the hierarchical ladder. I'm the one that work and work and work all day long. I don't make decisions. I'm not involved in any way. Sometimes someone else must change the situation for me. So this person doesn't speak up. Probably don't say, I can see that something is wrong here, which is a problem, of course. So what can we do with all this mess? There is different methods to improve communication. Have any of you heard about SBAR? Yeah, some? It's a model. It's short for situation, background, assessment, and recommendation. You can read up online. There's lots of information about SBAR. It's a technique for communication between members of the healthcare team about a patient's conditions. And that's to make the communication systematic. And we have a lot of evidence that this model improves the care and the communication in healthcare. But you need to learn it. The thought behind is that all important information is transferred correctly, that you have full attention to the person that you communicate with, and it helps staff to give a better structure. And for us as nurses, we're trained to have a holistic view, to see things from different perspectives. So we tend to put too many words into things for the people on the other end that should understand to see the key issue. If we're self-critical, I think we need to work a little bit with that. And this is, SBAR is supposed to reduce the risk for misunderstandings, and help you focus on the important issues. Another model, it has actually different names, but briefing, debriefing is the common name. Anyone heard of that? Yeah. You start the shift with your small group of people, a few minutes, and plan the day. A good metaphor for this, I think, is at the football field before the match when the team gang up, and we call it situation awareness. This is the job we're going to do today, and we're going to do it together. And they plan the work, divide the work between them with a few minutes. You can see one of the nurses there have a card with some issues they go through. Who's the team, and what we're going to do today, and how we're going to focus on safety. And in the end of the shift, you do the debriefing. What did we do good? What could we improve? So we give each other feedback. This has been described as the best way of improving professional communication in healthcare, and I really believe it can. The third model is one of those really easy ones that you can start doing right. You don't need any training. It's called Closedloop. You might already do it, actually. It's when you send information, you try to be clear, which is easy to say, but you're also clear in who you communicate with. You take eye contact. So if I talk to Christina, I talk like this, and she nods. Everybody does. I'm not saying I want your help to all the room. I show which one I'm communicating with. And the receiver express that you have understood, like you did, and repeat if needed, say it out loud. And both parts are responsible for the communication to work. You hear this in aviation when you fly. They say cross-check in the front, cross-check complete in the back. That's closed-loop communication. The whole crew knows that the checks, the safety checks have been done. And other strategies for improved safety, before I finish, is to put safety first. Decide in your team that safety is your #1 priority. And to always speak up. To involve the patients in the safety work. That doesn't mean that you let them have responsibility for the safety, because that's always the healthcare professionals, but to involve them so they know that they're going to tell you if something is wrong. You can also implement quiet zones, for instance, where you prepare infusions or injections so you don't disturb each other, to try to reduce the flying information when you do something really important. And talk about safety issues with each other in the coffee breaks. And also to have computerized prescription, for instance, for chemo. I have a terrible example here. This is how it used to be. And when I saw this, I realized what doctor it was. I know her. I've not met her for over 10 years, but I know exactly who she is. She's not on her own. Yeah. And also about close calls. As nurses, we very often the last link before a medication or a treatment reach the patients. And WHO have studied this, and they've shown that 86% of the errors made earlier in the chain when you prepare and give a medication can be prevented if nurses speak up before they give a drug. So if you see something wrong, you ask the questions. And when an error occurs, because they will do, whatever you do, we are all humans and we will make mistakes. But you have to focus on what happened rather than who made a mistake. Because that's when you learn. What could we learn? To have open dialogue with patients and their families. And also to support staff, because those of you, I'm sure I'm not the only one that's been involved in serious incidents in healthcare. It's horrible. It's really, really bad, and you need support from your colleagues and your management. You need to document carefully what happened. And another suggestion is bedside handover, so include the patient and the family in the handover between the shift. We're doing research at Karolinska at that right now, and we find some very interesting results. You get first-hand information. It's more person-centered, and it's an opportunity for daily safety check. Is it the right infusion, the right patient? Does the patient have the right information? And it's much less integrity issues than we assumed. So the patient is fine with doing the handover, and they actually really want to be involved. And finally, a quote from a professor in patient safety, Richard Cook. And that's going back to the initial story. To act and to take a person seriously when they tell you something is or feels wrong is always much more important for safety than all the models I've been talking about, like SBAR and briefing and debriefing. So actually listen to anyone of the team, whoever they are, is the most important thing. Thank you.